We start, though, this morning with rising coronavirus infections nationwide. Cases are increasing in all 50 states, sparking a fourth wave of infections.
Dr. Anthony Fauci says the pandemic is going in the wrong direction and that the Biden administration is considering whether to bring back some mask guidelines.
The outbreak is an outbreak among the unvaccinated predominantly, not exclusively, but overwhelmingly, predominantly.
A sign of just how dangerous this wave could be. Just last night, Louisiana Representative Clay Higgins announced he tested positive for the coronavirus for a second time. The GOP congressman has publicly encouraged people to get vaccinated, but won't say if he got the shot. There is a hopeful sign this morning. As cases rise, so are vaccination rates in some states getting hit the hardest. These 5 states with the highest case rates now lead the country in the rate of people getting vaccinated. In hard-hit Arkansas, the vaccination rate over the past week is 3 times the U.S. average. NBC News Now correspondent Maura Barrett joins us now to walk us through the biggest coronavirus headlines of the day. So, Maura, let's start with this rise in vaccination rates. How are states handling not only the increase in the number of cases, but also now the greater demand for vaccines?
Good morning. You're right. We're seeing this correlation where there's an increase in cases, now seeing this spike in vaccination rates higher than the national average. Now, the White House is suggesting that this is because people are seeing the effects of people who are unvaccinated getting sick. Maybe it's their family or friends getting sick, and so they're choosing to get vaccinated. But states like Arkansas, like you mentioned, are saying that it's because of the positive messaging that they're now pushing around vaccinations. And that's what they're really trying to focus on in order to get people vaccinated. Obviously, we know there's plenty of vaccine available around the country. And so these states trying to make sure that they're messaging more positive instructions for people to get vaccinated. However, this also comes at the same time that certain states like South Dakota, Iowa, Florida have pulled back on their reporting data. Instead of reporting COVID cases daily, they're now doing it weekly. And so this could have an impact as we look at trends going forward and how states need to respond that way, Joe.
So, Maura, Dr. Anthony Fauci said yesterday during his tour of Sunday shows that federal officials are having conversations about bringing back mask guidelines. Here's what he said about current mask rules.
The CDC still says and recommends that if you are vaccinated fully, that you do not need to wear a mask indoors. However, if you look at what's going on locally in the trenches in places like LA County, the local officials have the discretion, and the CDC agrees with that ability and discretion capability. That's a local decision that's not incompatible with the CDC's overall recommendations that give a lot of discretion to the locals.
So do we know what those conversations at the federal level are looking like? Obviously, as we mentioned, LA County, St. Louis, they have mask mandates right now. But could more Americans expect to mask up again in the coming weeks and months?
It's definitely a possibility. Dr. Fauci is saying he's very frustrated and that we're trending in the wrong direction. He did say that a new mask mandate by the CDC is under active consideration, but right now, obviously deferring to those localities like LA. They reinstated their indoor mask mandate. St. Louis will require the same, as well as on public transportation. There are some places, like if you're eating at a restaurant, that you don't have to do it, but it is going to be up to the localities for now. You even have Arkansas's governor defending his decision to keep in place a statewide mask mandate ban. And so, like we've seen throughout the pandemic, this differentiation and guidance from state, federal, and local officials, and then we see those decisions made on partisan lines when it comes to reinstating those mask mandates. We might continue to see that same trend among the localities.
Yeah, 2 very different approaches there. Maura, while we have you, I want to talk about one major consequence of the pandemic. That is that some hospitals are facing staffing shortages. Here's an example. The Oregonian newspaper reports that hospitals in Oregon seriously understaffed. What is the impact of that, and what incentives are some care providers offering to try to get more people back to work?
Well, these hospital caregivers are just simply exhausted, understandably, after 18 months of this pandemic, now seeing another surge. A lot of Oregon hospitals specifically already recording record patient volume. They're seeing a delay in patients being seen in the ER because people who work in the hospitals have moved to less stressful jobs or left the industry altogether. And so some of these hospitals, like we've seen with businesses trying to hire new employees, they're offering incentives, for example, asking if nurses who are willing to work overnights instead of their day shifts, or asking them not to take any sick days during the summer. They're offering incentives as high as $12,000 in order to fill those holes, Joe.
All right. Thank you, Maura. Appreciate your reporting this morning.
Let's now bring in NBC News medical contributor Dr. Natalie Azar. Dr. Azar, good to see you on this Monday morning. So we heard Dr. Fauci's warning about a surge in cases and then therefore deaths because there are so many people still unvaccinated. So let's just first kind of help us set the scene here. How bad could this get? And then is there also still time to head this off? I mean, we hear these encouraging news that vaccinations are ticking up in those same states where cases are ticking up. Is that going to help us here?
Yeah, let me get to the second point of your question first, Savannah. The only thing that's going to make a difference here is vaccination. It's still, yes, important, boots on the ground, doing contact tracing and isolation and things like that in areas with low vaccination rates. But the vaccine is the only thing that's going to turn this around. You know, there's a lot of really good graphs this morning. If you are into these things, I tweeted out an image from the New York Times that basically shows, you know, where we are on this slope upward now is very similar to where we were a year ago, which is super unfortunate, right? And we had a real nice dip in the spring. And why? That was because that was before Delta and when we started vaccinating. Stat this morning has a really interesting look at it too that says not only is the velocity increasing, but the acceleration of cases is the highest that it's been compared to any prior surge, and we're essentially in the fifth one. I'm not a doomsday person at all. I usually like to at least give a silver lining to everything, but I have to tell you right now, with the transmissibility of this Delta variant and the lag in vaccination rates, I think we're going to see a significant surge, and it's going to get worse before it gets better.
Dr. Azar, speaking of unvaccinated, we've been hearing these heartbreaking reports of people who have been hospitalized with COVID who had not prior had the vaccine. Now, asking doctors for the vaccine when they're in the hospital. We've had some of our incredible reporters, in fact, hearing people begging for the vaccine when they are already in the hospital with this virus. How soon can those patients get the shot if they currently have the virus? We know it's not something that can be or would be helpful to be administered when they're in the thick of it. But after they've been in the hospital, how long until they can have it? And what does that mean for them then?
Right. So basically, if we go back, to when the vaccine rollout first was happening, the CDC said if you were infected with COVID-19, wait 90 days to get the vaccine because that was when vaccines were in such short supply. The rule of thumb now is that if you have recovered from COVID-19, so let's say 10 days with a mild illness from symptom onset or a positive test, or 20 days for more severe illness, you can go ahead and get your vaccine. Now, the exceptions are if you received monoclonal antibodies or convalescent plasma treatment for your COVID-19, you need to wait 90 days. And also, if you had multisystem inflammatory syndrome, either as an adult or as a child, you're supposed to wait 90 days from the time of that diagnosis. But for everybody else, as soon as you're recovered, yes, please go get the vaccine.
All right. That's great information that, as you mentioned, was quite a bit different than the guidance we first received. So thank you for that. Now let's finally talk about masks. We also heard Dr. Fauci addressing the potential change in mask guidance. And one of the most contentious points here in this conversation is the consideration of recommending children under 12 wearing them when they head back to school. Of course, just a few weeks from now at this point. These are kids that aren't yet old enough to get the vaccine. So most of these kids heading back into the classroom, if they're under 12, unvaccinated, we now have this more infectious Delta variant. How does that affect that conversation? Because you hear so many parents saying, look, kids are just not going to keep a mask on all day, or now adults aren't wearing them, so the kids aren't going to follow that example anymore. But what does it mean if we know these kids are heading back in a closed place like a classroom, unvaccinated with the Delta variant?
So I think there's absolutely no doubt that the recommendation is going to be that kids are going to need to wear masks. Look, last year we knew that when kids were in school wearing masks before vaccination, everybody was safe, and school was not the place where we saw community transmission, that wasn't the place where it started. It was the other way around, right? If there's a lot of transmission in the community, it filters into the school, not the other way around. It's going to be a safer environment because presumably many of the staff and teachers are going to be vaccinated. But this Delta variant is tricky, Savannah. People have roughly 1,000 times more virus in their nasopharynx when they get exposed or infected from this. They shed more, they produce more, and they become infectious earlier. It would astound me if masks weren't required for school for kids this year. We got to keep them in school, and this is the way to do it. And that's the small sacrifice. I would say maybe an exception in sort of the really young kids, the preschoolers, because we did not see outbreaks in those settings. Maybe that there's a difference there. But otherwise, I think in elementary schools, it's going to be a no-brainer, and certainly secondary schools.
Well, and as you mentioned, the Delta variant being tricky, we're also seeing younger people ending up hospitalized. Something else, of course, is a concern here. Dr. Azar, always great to have you. Thank you so much. Congressional leaders are still sparring over the January 6th committee, with House Speaker Nancy Pelosi adding another Republican member after GOP leader Kevin McCarthy pulled his choices. NBC News White House correspondent Monica Alba has the latest.
The congressional committee investigating the January 6th attack on the Capitol has another Republican member. House Speaker Nancy Pelosi adding Illinois Congressman Adam Kinzinger today, writing, "He brings great patriotism to the committee's mission to find the facts and protect our democracy."
We will find the truth. That truth will have the confidence of the American people because it will be done patriotically and not in a partisan way.
The congressman, a frequent critic of Donald Trump, explaining, "I'm a Republican dedicated to conservative values, but I swore an oath to uphold and defend the Constitution. When duty calls, I will always answer." He joins Congresswoman Liz Cheney on the 9-member panel, the only other GOP voice since Minority Leader Kevin McCarthy pulled other Republicans from the group after the speaker rejected 2 who had been supportive of Donald Trump's false claims about the election he lost, which the former president repeated in Arizona Saturday.
When they steal it from you and rig it, that's not easy, and we have to fight.
The first committee hearing is set for Tuesday, where Capitol police officers will testify about their personal experiences, some of which even motivated their newly named chief to come out of retirement.
If you would have asked me on January 5th, you want to be a police chief again, I would have said, no, I'm fine. I'm enjoying retirement. But the events of January 6th changed that.
Leader McCarthy slammed Speaker Pelosi's decision Sunday evening, saying, quote, "Members who share her preconceived narrative will not yield a serious investigation." Savannah?
All right,
Joe?
Monica, thank you so much.
Former President Trump's close associate, his inaugural committee chair, Tom Barrack, will make his first court appearance in Brooklyn today. Barrack was arrested last week on multiple charges, including illegal foreign lobbying on behalf of the United Arab Emirates. On Friday, he was released from federal lockup on an astounding $250 million bond. NBC News investigations correspondent Tom Winter joins us now. So, Tom, first of all, let's kind of take a step back and remind everyone, who is Tom Barrack? How close was he to the former president? And what are the charges he faces?
Right, Joe, good morning. He's a 30-year-plus personal friend of the president and the former president of the United States, Donald Trump. On top of that, he's somebody who advised him during his campaign. He's the former chairman of the Trump inaugural, which had an enormous haul from a fundraising perspective. So this is somebody who's not just a new entry into the Trump orbit, as we had seen with, say, a Paul Manafort or a George Papadopoulos. This is somebody who's been in the president's corner for a long time. But according to federal prosecutors, while he was in the president's corner, he was also in the corner of the United Arab Emirates, lobbying, as you said, on behalf of them. It wasn't just that. He also provided sensitive, non-public information about other members of the Trump administration and their feelings towards the Middle East and Middle Eastern policy back to the Emiratis, according to the indictment. And on top of that, when he was confronted by the FBI, Joe, he lied to them as well. That's what he's been charged with.
Let's talk about today. What can we expect from his first court appearance today, and what should we expect as the case moves forward?
So people who've been closely following this case will know that today's court appearance is called a first appearance, which is kind of funny because it'll be the third time he's had a hearing in this case. But when you're charged in the United States in the federal system, if you're arrested somewhere outside of the district where you're charged, you do have to then present yourself in front of that district to actually have your first appearance. It is likely that he will enter a plea. His spokesman has previously said that he will plead not guilty. So that's what we expect today. It'll also be up to prosecutors and the judge to determine whether or not they're going to keep that $250 million whopping bail bond in the terms associated with it, which include very limited travel, and he can no longer use the private jet, Joe.
And Tom, this is just one of several investigations focused on ex-Trump associates in legal jeopardy. Others include former personal attorney Rudy Giuliani, former Trump Organization CFO Alan Weisselberg. Could any of these people be tempted to turn on the former president?
Well, you know, we've been kind of playing this flip-a-palooza game, as I call it, for the last 4 years or so, trying to figure out who could possibly testify against Donald Trump. You know, that hasn't happened yet. And one of the reasons why could be strength of evidence, what they could actually have to offer. But you know what, Joe, when you look at the financial filings from the Trump campaign, there's no payment to Rudy Giuliani for all of that traveling, all of those lawsuits that he filed on behalf of the president. You have to wonder if that might come back to haunt him someday.
All right, we know you'll stay on it. Tom Winter. Tom, thanks so much.
Sure thing.
A dangerous mega fire in California is now one of 86 wildfires destroying land and upending lives, and it's only getting bigger. NBC News correspondent Guad Venegas has more.
Firefighters escaping deadly flames from the Tamarack fire near South Lake Tahoe, California, just in time.
You seeing that, Brandon?
A giant fire whirl caught on camera. Just one of the 86 wildfires across the West, destroying homes, damaging critical infrastructure, and forcing thousands to evacuate. Governor Gavin Newsom declaring a state of emergency in 4 counties, with flames crossing into Nevada and the Dixie Fire near Paradise, California, exploding into a mega fire consuming more than 100,000 acres.
It's scary. I've never been through anything like this.
In neighboring Oregon, things are worse. The Bootleg Fire consuming over 400,000 acres.
There's still several thousand people that are threatened by the fire.
And this is all drier than usual.
Sure, yeah. I mean, everything's drier than usual. We're seeing on the Dixie Fire, it's primarily a fuel-driven fire.
The smoke smothering the entire country. NASA releasing this image Friday, fumes again reaching the East Coast. Thousands of firefighters working around the clock, saving lives remains the priority.
We grabbed as much as we could and got out. Didn't have much time, but we got out alive, so that's what matters.
Out of control wildfires now the norm as global warming continues to pose a threat.
Let's get a check on the weather out west and around the country this morning.
Yeah, hi, Janessa Webb. Good morning.
Hi, good morning. You know, those dry conditions, they're going to be persisting across the West Coast. Definitely not what we need to be hearing right now. Hopefully, we'll start to see a change in the jet stream that will allow a little bit of moisture. But our Olympians, they are definitely going to be dealing with moisture for the next couple of days. We do have a tropical storm that is continuing to spin in this area, 40-mile-per-hour winds. Now, throughout the overnight, this has transitioned into more of a system that is going to linger towards the north before it enters Japan. So our latest forecast, Tokyo out of the cone. But I do want to show you some video that we are seeing some high surf. This is going to be a big time issue across this area. As you know, surfing is definitely a new sport in the Olympics. This could help our Olympians, but, you know, forecast is likely to change in the next few hours as some high surf along with some beach erosion really going to be a problem across coastal areas of the Tokyo region. But we are definitely seeing a positive where this storm system, instead of a direct eye on Tokyo, now is lingering to the north. Guys.
All right.
Thanks,
Thank you.
Janessa. See you in a bit.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.